Greetings, everyone, and welcome to episode 23 of the Haelan Nurse Chronicles. I'm Dr. Lorre Laws. I'm your host, and I am a nurse scientist, an author, and a trauma burnout expert. Today, we will be discussing the phenomenon of patient burnout, which has recently been reported by mainstream media outlets as a simmering public health crisis. We'll take a look at this patient burnout through the lens of the patient perspectives and also through the lens of avoidable nurse-specific traumatization, for it appears as though the two go hand in hand. So get comfy and then we'll get this party started. What is patient burnout? Well, patient burnout in the healthcare system is a growing concern that adversely impacts both patients and healthcare professionals. Factors contributing to patient burnout include long wait times, limited communication with healthcare providers, complex and confusing medical information, and the lack of emotional support during challenging times. As patients navigate the complexities of the healthcare system, the overwhelming demands and frustrations that can lead to emotional exhaustions, feelings of helplessness, and results in a decrease in overall well-being. Patient burnout is really a form of system-induced trauma, and we'll unpack that in more detail. The repercussions of patient burnout extend beyond individual experiences to impact healthcare outcomes and the well-being of nurses. Burned out patients are more likely to experience medical errors, medication errors, reduced satisfaction with care, and delayed recovery. This, in turn, places additional strain on already overworked nurses who are tasked with providing quality care in increasingly challenging circumstances. Addressing patient burnout requires systemic changes in healthcare delivery, such as improved communication, streamlined processes, and increased support services to ensure that patients receive the care that they need, while also supporting the professional well-being and safety of those who are providing care for them, which includes nurses and all health professionals. So once again, we have healthcare system inadequacies that are at play. Patient burnout in the healthcare system is a direct result of healthcare system inadequacies that contribute to the traumatization experienced by patients. Factors such as long wait times, limited communication with healthcare providers, complex medical information, and lack of heart-centered, fully present emotional connection with their providers and caretakers really contributes to the psychological trauma that is endured by many patients. The overwhelming demands and frustrations within the healthcare system can lead to emotional exhaustion, feelings of hopelessness, helplessness, and declines in not only patient, but provider and nurse well-being, perpetuating the cycle of patient burnout and nurse-specific traumatization. So we will drop a graphic in the show notes that really highlights through the lens of Dr. Foley's neuropsychological trauma middle range theory about the individual traumas that every nurse and every patient is exposed to in the course of everyday living, in their lived history and their experiences. And then patients, just like nurses, when they enter the healthcare system, they are presented with even more trauma exposure. And let's unpack what those might be. The failure of the healthcare system to address the inadequacies not only impacts patient outcomes, but also perpetuates the cycle of traumatization experienced by patients. So patients who experience burnout and dissatisfaction are more likely to exhibit the symptoms of emotional distress, and these symptoms impede their ability to heal and further exacerbates any unintegrated trauma that was within their bodily systems as they entered the healthcare context, and then is exacerbating by the system-induced trauma. So here we are, we have traumatized patients entering a system that is further traumatizing, and then asking nurses who are experiencing nurse-specific traumatization to provide their care. It's a trauma trifecta of a whole nother breed. So let's unpack how some of the same factors that contribute to nurse-specific traumatization also contribute to patient burnout and medical traumatization. So first of all, patients like nurses, we're all whole persons with unique individual trauma histories that can include acute or chronic traumas, complex traumas, developmental and neglect traumas, to name just a few. And then patients enter a healthcare system that is not designed to meet their needs, but rather designed to meet the needs of the healthcare organizations, lobbyists, politicians, and mega corporations and venture capitalists. Let's not forget venture capitalists. Patients are literally being steamrolled by the system that is supposed to be serving them. And those who are providing the care for these patients are similarly burned out and traumatized. Patients and nurses alike are experiencing system-induced trauma. The health systems and organizations that are supposed to be helping patients are sometimes unknowingly and oftentimes knowingly inflicting additional trauma exposure instead of healing opportunities on those that they serve. Policies that are designed to increase profitability and return a high venture capitalistic investment return do not prioritize patients or their needs, just like they don't prioritize the needs of the nurses who are delivering the care. If you want to see evidence of this system-induced trauma, just try and read any insurance policy. Pages and pages and pages of complex insurance ease language that aims to overwhelm the patient into just going along with the status quo of making money for everyone instead of supporting their agency to receive high quality, effective care that is delivered in a safe and compassionate manner. Nurses and patients alike are experiencing the effects of insufficient resource trauma. It's a trauma double whammy. So here's the deal. In the best of decades, nurses and patients face devastating traumatic events. And these individual traumas are often only partially healed, partially integrated. That means that the unintegrated trauma, or what I like to refer to as the unhealed bits of wisdom, gets stored in the body until such time that conditions are favorable for healing. Well, guess what? Conditions are not favorable for healing in most healthcare settings. They just aren't. Nurses, physicians, and healthcare professionals are experiencing unprecedented numbers of burnout and work-related post-traumatic stress disorder. Patients, too, are bringing their own unintegrated traumas into a system that is further traumatizing them through system-induced and insufficient resource traumas, and while being directly or indirectly exposed to the effects of workplace violence trauma. There is any number of workplace traumas that are workplace violence related. This is downright physical abuse, verbal abuse, gaslighting, bullying, hazing, and the implicit historical trauma that is transmitted through the healthcare worker transmissions, often unknowingly so. So what we have here, sadly, is we have traumatized patients being cared for by traumatized nurses. And then we wonder, why are nurses leaving the profession in droves? Well, because they don't have the resources they need. They're not safe in their practices. They're being exposed to an inordinate amount of workplace violence. And as a result, patients, their care experience, and their care outcomes, well, they're too floundering. So my message is this: just stop. My message to the system, to healthcare organizations, is to please stop. Help us to end the systematic burnout and avoidable traumatization of the patients and their nurses. So what are some strategies that we can do to prevent patient burnout and medical PTSD? Well, patients can advocate for themselves by asking questions about their care, seeking support, resources, and educating themselves on their rights within the healthcare system. Patients can engage in specific trauma healing practices, such as mindfulness, grounding techniques, and self-soothing strategies to address the emotional distress caused by system-induced trauma. For example, patients can use grounding techniques to stay connected to the present moment during what might be called flashbacks or intrusive thoughts or memories. By incorporating trauma healing practices into their daily routines, even while hospitalized, patients can continue to build resilience and learn how to cope with stress reactions while taking control of their well-being in the face of healthcare system inadequacies. Together, nurses and patients can work and collaborate to create a culture of healing, of true healing, within this support of healthcare systems to address the pervasive effects of avoidable traumatization on both individuals and the healthcare system as a whole. So conditions that are ripe for healing mean that the person and the nurse are positioned in right relationship to repattern in one or more body, mind, spirit, or what I like to call body, mind, essence domains. But first and foremost, patients don't feel safe in healthcare settings, and neither do nurses. That's the single most important thing that needs to be addressed. Now, how can we help nurses who are experiencing nurse-specific traumatization? Well, to address the effects of avoidable traumatization in healthcare settings, nurses and patients both can take proactive steps to advocate for themselves and engage, excuse me, in specific trauma healing practices. Nurses can staunchly advocate for themselves by demanding adequate resources, safe staffing levels, and trauma-informed training with their organizations. We are the linchpins of healthcare delivery, and nurses continually allow the healthcare system, their organizations, their management, their leadership to steamroll them. But it's time. We have to prioritize our well-being, our mental health, and protect ourselves from burnout and provide more effective care to ourselves to insulate ourselves from the avoidable trauma exposures. And this will in turn help our patients. We can engage in any number of evidence-based practices such as somatic experiencing, trauma healing practices that focus on releasing the stored trauma in the body through physical sensations and movements. We can incorporate these somatic experiences into our self-nurturing routines and really start to build the resilience in the face of trauma, system-induced trauma. Now, mind you, let us be clear that it is the system's responsibility, not ours, to create safe, occupationally safe working conditions that are adequately staffed and resourced. Our responsibility as nurses in the interim is to learn how to insulate our nervous system, learn how to insulate our body, our mind, our vagus nerve, so that we are not devastatingly affected by how inadequate healthcare working conditions are right now. In addition to advocating for ourselves, we can engage in trauma healing practices, any number of which are evidence-based and are aimed to prevent or address nurse-specific PTSD symptoms. And it starts with taking personal responsibility for our part, protecting ourselves, ensuring that we are professionally safe and well. And these strategies can include healthy boundaries, setting those healthy boundaries. No is a complete sentence. Not answering your phone or texts or emails on your days off is an appropriate response. Practicing mindfulness and relaxation techniques is helpful. For those who are kind of in sympathetic overdrive, you might need movement-based mindfulness activities, because you have all of the cortisol and the adrenaline and the noradrenaline that might make stillness challenging for you. Seeking out peer support networks for emotional validation and camaraderie is helpful. Participating in regular physical activities. We all know this as nurses, that helps both our physical and mental well-being, and really attending these trauma-informed trainings to help us understand how to navigate our nervous system and our vagus nerves so that we can incorporate this into our self-nurturing rituals and practices. Also, seeking professional support. Oftentimes we need to do that outside of what our employer provides. And why is that? Because most of us do not feel safe in our work settings. So trying to access employer offered resources, particularly those that are on site, well, it's like asking a firefighter to go meditate inside of a burning building. It's just not effective. And it's because we don't feel safe and our nervous systems can't regulate if we are feeling unsafe. And so seeking professional services by experts such as myself and counseling and therapists to help us address the current trauma exposure while resolving the unintegrated trauma that is stored in the body will help us not only to be safe, professionally well, and thrive in our practice, but it will then empower us to be change agents within our units, our teams, and our organizations. By incorporating these evidence-based strategies into our daily routines, we can proactively address nurse-specific traumatization and its symptoms while building trauma-informed resilience and a sense of empowerment in our practice. So let me leave you with this take-home message. Patient burnout is real. Patient medical PTSD is real. Nurse-specific traumatization is real, and we can help. If you or someone you know has been affected by nurse-specific traumatization, please seek support immediately. I conducted 5 years of research across 4 disciplines to emerge with an evidence-based framework that can guide nurse-specific trauma healing. I and my team are standing ready to support nurses however possible. I am standing ready with my team to help support healthcare professionals however possible. Please consider joining my Nurse Trauma Master class or schedule a call with me, and we'll drop both of those links in the show notes. However I can show up and my team can show up to help you, whether it's through a master class or through a personal call, please explore the healing options that are available to you. Until next time, thank you, thank you, thank you for all that you are and all that you do. I see you, I feel you, I hear you, and I am here for you. From my healer's hearts to yours. Namaste.